Prehab is a new concept. It was brought up by the orthopedic surgeons where they would get their patients to do exercises and nutritional stuff to get them ready for surgery to try to get better results. It has not really been used for heart surgery to date, but we're about to start it at our hospital. Prehab just means getting the patient into better shape, and I will outline a few of the things we're planning on doing. Exercise is not something we can spend a lot of focus on because if you have heart failure, you don't usually feel like exercising. If you have unstable coronary disease, exercise is probably not your best treatment. So we're focusing on some other things. Exercise would be nice, but we're going to focus on some other things like colon preps. One of the causes of low blood pressure after heart surgery is endotoxin reabsorption, where the liver is not working at its best because of ischemia, and the bowel, which is not working its best because of ischemia from being on a heart pump, may let endotoxin into the circulation. We're going to try to prevent that with some charcoal. Charcoal absorbs endotoxin. Just give the patient some charcoal, let it be in their GI tract when they have surgery. To my knowledge, nobody's tried this yet, but there is a lot of information about what it does to endotoxin. Now, I think exotoxin may be even more important. Again, no information available right now. Magnesium loading is something you can do. It's a laxative, as well as heart patients do better with a bunch of magnesium. So we'll give them magnesium before surgery. And I would like to institute ketosis as I could. We have a segment on this afternoon. We'll talk more about the details of ketosis. But if you get a patient in a ketotic state where they're burning fat, have ketone bodies floating around in their bloodstream, this is very anti-inflammatory. So patients would have less pain, less inflammation, and we hope do better. This is not proven. I recently had some of my wisdom teeth pulled out, and I made myself ketotic for a day and a half. I had no post-op pain. I still have a pain pill prescription at home. If somebody would like it, I'll give it to them. Another way to get ketosis is to take brain oil. Brain oil is a medium-chain triglyceride. It's sold in a bottle that looks like that. It's sold by a group called Bulletproof. Very interesting group of people that have a lot to do with what I know about ketosis. Anyway, brain oil is a C8 fatty acid that is almost totally converted to ketone bodies when it hits your liver, and it's absorbed very quickly. The follow-up of this to see if this helps people is going to be to check the perioperative infarction rate, which is what POMI is. Complications of heart surgery mostly emanate from perioperative infarction. So if you can have no heart attacks in surgery, patients do better. That's obviously related to mortality, how long you stay in the hospital. Atrial fibrillation is the main reason that people have prolonged stays after heart surgery. Prolonged stays means less bottom line profit. We'd love for people to have a short stay. And it's not because I don't want to make rounds on them. It's all about the benefit of the patient. The other effects is what effect will this have on their diabetes? People have a big stress response with surgery. They run their blood sugar up, they end up getting a lot of IV insulin, complicated routines, but we don't know what this will do yet. The amount of pain medicine is always hard to evaluate because it's more related to the personality of the patient than the disease, but nonetheless, the less pain medicine you take, the quicker you get over surgery. How your brain functions after heart surgery, especially in older people, will be very interesting to see. Ketosis makes your brain work better, makes you mentally sharper. So the day or two after surgery, patients do not eat anyway. So if they go into surgery ketotic, they should stay that way for 2 or 3 days. This is brand new stuff. We don't know what it's going to do, but we're always trying to do something to make things better. And maybe this will be one of them. That's all I got. Thank you.